Hello, everyone. I'm Jill West. I'm the Sleep Clinical Specialist at Cadwell. Just want to thank you for joining us today for a webinar using education to address the sleep tech shortage from Amber Allen. We are excited that you're able to spend time with us today for this. So before we begin, just a couple housekeeping items. This educational activity has been designated for up to one continuing sleep technology education credit by the BRPT. To earn the credit, you do have to sit through this wonderful presentation in its entirety and also complete a brief post-survey webinar. So after this session, just double check your inbox. You'll receive an email from Cadwell Education with a link to that survey. Today's webinar is also going to feature a nice Q&A session with Amber, so that way if you do have questions throughout the presentation, just put those in the chat box and we'll try to address them as much as we can, as many as we can after the presentation. So in support of furthering education, I do want to call out both Amber and Cadwell. But we've pledged funds towards the scholarship funds at Collin College to help broaden the horizons of a lot of new techs coming into the field. So thank you, Amber. Thank you, Cadwell, for being generous. It's so wonderful, especially riding on the hinges of Sleep Tech Appreciation Week. So without further ado, it's my pleasure to introduce today's speaker, Amber Allen. Amber, many of you probably already know her. She's been active in the field of sleep medicine since 2008. She currently serves, this is a mouthful, Program Director of the KHEP accredited program at Collins College. Previously, she's been a sleep tech at the Cleveland Clinic. She's also the current president of the BRPT. She's presented at numerous international, national, and state level conferences. She's on the Sleep Technologist and Respiratory Therapist Education Committee for the AASM. She's also about to add some more letters to her signature line with an MBA. And in a few weeks, let's see, you'll be at the first International Sleep Conference in Rome. So very, very busy lady. We're happy to have her today. In addition to her professional achievements, I'd like to shout out that Amber's a proud dog mom to her little pup, Mia. So please join me in thanking Amber for leading today's session. Amber, I'll hand it over to you.
Thank you, Jill. So I am tackling that age-old question of how we got to the sleep tech shortage. What can we do? It is the buzzword. I go to a lot of conferences in the industry and everybody is asking, how do I get more techs? What do I do? And so I'm going to kind of go through some of the aspects that got us to where we are, as well as to address how to try to repair some of this kind of damage that we've got here going on, and also kind of look towards the future of our profession. So as far as my speaker disclosure, as Jill mentioned, I am the director of a KHEP accredited polysomnographic technology program. And in addition to the accredited one, we also have two BRPT STAR designated educational programs under our umbrella. And so I manage program administration, curriculum development, and maintaining accreditation standards for those entities. I don't have any financial conflicts of interest as far as anything to disclose in regard to the content of this presentation. So diving into our learning outcomes. So we're going to kind of take a dive into how we got to where we're at right now. What are those attributing factors that brought us to the point we are today? And then also looking at how we can use education to address the sleep technologist shortage. There's a lot of avenues that can be explored by sleep centers, as well as partnering with our educational providers. And then also talking about what happens if we don't get this problem fixed. So what are those inherent challenges to the profession if we still have a sleep tech shortage? So I want to start off by kind of how we got here. So I love to talk with my students, kind of go through a history of sleep. And if we look at the history of sleep from when it started in 1970 at Stanford, if we look at every decade of this profession, we have some sort of major issue we've had to tackle. So in the 70s, it was, how do we treat our patients? Nobody wants a tracheostomy. We're still developing the field, trying to get all the parameters behind what it entails, how to make sure that those that are performing the studies have the right knowledge base and skill sets to perform those studies. So it was kind of that burgeoning start to the field. And then as we move into the 80s, we get this new invention called CPAP. And CPAP really transformed the way that treatments were done in our profession. So instead of the only option being a tracheostomy, we moved to where we have a therapeutic intervention that is non-invasive, and the majority of people can use it. So that kind of revolutionized the 80s. Then as we move into the 90s, we have the digital revolution of the profession, where we move from having just the paper studies and having to score everything by hand to having these computerized systems. And that helped also with things like storage, because in the prior iterations of our sleep labs, we had all these paper studies that had to be stored. It took up a lot of space. So with the digital age, it started to take that where it would make it more feasible to even open more centers and to see more patients. And then as we get into the 2000s, we actually had our first sleep tech shortage that occurred in that decade. And that's actually where I got into the profession, was during one of those shortages. So I can remember my mom calling me up and saying, hey, we badly need sleep techs for our sleep lab. And it's on the job training. So you don't have to go to school for this. You can actually learn on the job, and you can double your salary. As you know, somebody fresh out of college struggling to make ends meet, I'm like, sign me up. So it was one of those stories where we went through that, but also we started to see the requirements for recertification that occurred in that decade, where it was not just a grandfather system, but you had to maintain continuing education. We also started to see home sleep apnea testing start to creep into the profession. And then it really took hold in 2010. So that whole decade was dealing with how we've transitioned from primarily in-lab studies to now we have a patient population that's going to qualify for these home sleep apnea tests. And then as we move into 2020, of course, we go and deal with COVID. And dealing with COVID, we didn't fully recover from the sleep tech shortage the first time, but having COVID in the mix actually exacerbated the problem. And so we saw a lot of people in our profession decide to retire at that point. And when we look at numbers and when we look at statistics, the statistics really do tell the story. I heard Massey Arrington share at one of the sleep conferences, I believe it was last year, where he was sharing a statistic where about 57% of the profession has left in the wake of COVID, where we only have 13% new influx coming in. So we have this great imbalance where we have all these techs that went and moved out of the profession, but we don't have the next generation coming in to fill those spots. And so because we have that significant imbalance, and we're still dealing with that, and I'll talk about some of the reasons why we're still dealing with that. But as an industry, we have a lot of work to do. We have these holes that need to be filled, and it does affect down to patient care. So we have to figure out a solution to get to a place where we have our patients being well taken care of. So looking at the attributing factors, there's a number of things that got us to where we are today. So the first thing that we're dealing with is we have this growing awareness of sleep disorders because we do have a lot of our technological devices that have capabilities of detecting sleep. We're seeing a lot more usage of things like Fitbits, the Apple Watches, including the new Apple Watch iteration that has a sleep apnea detector. And with a sleep apnea detector, that's also letting people kind of be more aware of their sleep. And we also see things like the Aura rings. There's a lot of technological devices, a lot of apps even, that will detect things like snoring to sleep patterns. So because the growing public is having this awareness of sleep disorders, we're also going to see those same people that'll look at that data and say, what's wrong with my sleep? What do I need to do? And so they will come into the sleep centers wanting to be evaluated. So because we have that, we have an increased demand. But the problem is we have a limited number of training programs. When I looked at numbers for CAHEP accredited programs, so those programs that are accredited through CAHEP via COA-PSG, we only have 37 of those programs total, 37 for the entire United States. Of those 37, only 15 of them are actually associate degree level programs. So we do have a great challenge there because we don't even have one CAHEP program per state that we have in this country. So we have that big disconnect. And then also when we look at things from the BRPT STAR perspective, we also have only 31 total CPSGT or RPSGT BRPT STAR programs. Under that umbrella for BRPT STAR, we have 12 of those are self-study programs. 8 of those are focused STAR programs, which means they have a self-study component and they also have a 2-week live course to it. And then we have 11 that are focused too, which are that 2-week live course. So with 31 of those programs, again, if you add that up, we've only got between KHEP programs and STAR programs, we only have 68 programs for the entire country to facilitate learning in this profession. And then for higher level learning within this profession, there's only 4 CCSH STAR programs that are out there nationwide. So we have a very limited amount of training programs. And one of the other challenges that we see, when I started our program here at Collin College, when there was 50 programs that were listed, one of the challenges that we see, especially in higher education, is that leadership looks at numbers and they're comparing, because they don't know the way our field's set up, they're comparing us to nursing and respiratory and all these other allied health professions that have much larger applicant pools. And so we see these programs that struggle and get shut down because administration doesn't understand we still have a need for education in this field. We also have an aging workforce. We have, as I mentioned, a lot of folks that retired in the wake of COVID. And so when we do surveys through the BRPT and look at the age of our workforce, we have in the next 10 years, another 25% that will likely retire. So we do have this big, huge gap that needs to be filled. We need to get the next generation in, but how do we get high schoolers excited to be a sleep tech when they graduate? We have a lot of awareness that we need to create. So lack of awareness is that other issue. When I talk to high school students or I talk to ones that are doing health science programs in high schools, what the students are saying they want to be when they grow up is, I want to be a doctor, I want to be a nurse, but there's this lack of awareness of other allied health professions, sleep included. But when students realize this is an opportunity, they light up. I just did a high school fair actually a week ago Friday. And I kind of use this tagline with the high school students. I said, do you want to make an average of $63,000 a year watching people sleep? It kind of opens the door for conversation because they're like, what? This is something I didn't know existed. And so it just gives you that opportunity to share about the profession. So that lack of awareness of the profession. And then the technological advances, we're seeing more and more technological advances that change the way we do things. So the sleep center that is not the sleep center that is today. And so we have all these technological advances that are factoring in. And again, those devices that are creating this awareness of sleep and sleep problems factor into this. And then also the things of, we're seeing a rise in AI, and some of these positions kind of shifting where we're seeing where we can utilize some of this technology to do some of the menial tasks that we used to do as sleep techs. The other thing I'm seeing is stricter licensure and regulatory requirements. The state of New York jumps to mind. Talking to some of my colleagues that are in New York, one of the challenges they have with their licensure there is that they require you to graduate from a KHEP accredited associate degree level program. Well, it's not just any KHEP accredited associate degree program. They want it from somewhere within the state of New York. When you look at KHEP's website, there are only 2 KHEP accredited associate degree programs in the entire state of New York. And when those colleagues have reached out to their legislature to try to see if can be a change in this because they don't have the schools to facilitate the need for the entire state, their kind of response has been, well, we've seen actual programs in that state close down, and because respiratory can also do this profession, let's pass it off to respiratory. One of the challenges is that in the state of New York, respiratory actually makes a little more than sleep does. So therefore, it's not as alluring for those folks to transition to the field. So we do have this huge need in New York that is due to these stricter licensure and regulatory requirements. Another state I just saw that recently had some licensure changes was Maryland. In the state of Maryland, they only are recognizing those that have graduated or those that have taken the RPSGT through pathways 1 and 3 and 4, which are the education-based pathways. Pathways 2 and 5 do not have an education requirement for them. So therefore, in that state, they're not recognizing those that are coming in from those particular pathways. So with those stricter licensure laws and regulatory requirements, we're dealing with issues in specific states where they can't fill positions due to those specific requirements. The other thing is workplace challenges. Workplace burnout's very real. And so we have technologists that are being asked more and more of them, and they're not either seeing the compensation to go with it, or it's taking them away from their personal time. And so some of those workplace challenges, and also you have to have a sleep technologist to run the study. So scheduling becomes a challenge as well, because you have to make sure you have people that can work. And so that is another thing that a lot of labs are facing. And then we're seeing with insurance companies, especially, that requirement to be certified. So you have to have the RPSGT credential for many of these insurances for them to reimburse for a study. And so with those certification requirements, it's a challenge, because we see the overall pass rate on the RPSGT is lower than ideal. And so we see the first time pass rate being in the 70th percentile, but with retesters, usually that'll bring an average down. And so the average is in the 40th percentile for overall pass rate. So we have this certification requirement challenge as well, where we need people to be credentialed. So when we look at all of these attributing factors, how does this affect our profession? Well, if we don't have sleep technologists to run sleep studies, we're going to have longer wait times for those patients to be able to get into the lab. And so we'll see some of these labs that are booked out months. I know labs that are booked out clear through the end of the year already that have these longer wait times for sleep studies. And so will that patient show up? Will they get their study, or will they get burned out with waiting? And so that is a challenge. And then, like, as I mentioned before, the overburdened sleep technologist. If we're seeing an increase in labs that are moving to that 3-to-1 ratio, and that really wears out sleep technologists. And talking with some sleep technologists, I've even heard it beyond that. And that's kind of scary in the sense of patient care and making sure patient safety is maintained. So those overburdened sleep technologists impact on patient care. If you're having to facilitate more patients, then that challenge becomes, okay, what kind of care am I able to provide to those patients? Because you have to make sure that everybody's being taken care of, which takes away from some of that one-on-one education time that we may have had in the past to work with those patients to make sure that they understand their disorders. And then also the challenges in staffing. It's hard to schedule when you don't have the staffing to accommodate the patient demand. And so you've got to schedule, you've got to figure out when can people take vacations, what if somebody calls in sick. These challenges in staffing are very real and very much a part of this picture. So when I got into this profession, and I got in 2008, as Jill mentioned, and what I noticed when I came in is that, one, there wasn't a whole lot of educational programs. So it was very hard to get a robust training and really understand what I was looking at, the patient physiology, how what I was doing from titration perspective was impacting that physiology, and understanding what the mechanisms. I mean, that was all stuff, a lot of it I had to self-teach to learn those concepts. And so the lack of educational programs, and when I started as an educator, there was 50 programs, and it's just decreased over that time. So it's still a challenge even 16 years later. The other thing I noticed was a challenge was in-depth education. When I look at what kind of training I received, and I was like a lot of sleep techs that trained on the job, going through A-step, and not really feeling like I got the knowledge base that I felt was adequate to really be able to know what I was looking at and know how to interpret what to do and why I was doing what I was doing. I kind of was just following protocols that were established by the lab, but I really didn't know what it all entailed. And so that in-depth education, when developing a KHEP program, I really looked at what was that knowledge base that I was missing that I couldn't identify. Things like ECG arrhythmias, not knowing, is this something that's just a normal phenomenon, or is this something I should really be concerned about? And then also looking at all the different things that can happen in sleep, the medication interactions, a lot of this stuff that was not taught when I got into the profession. So that need for in-depth education and to understand all the parameters, because I've said this to numerous occasions when I've talked, that I really feel like sleep technologists need to almost be educated to a level of the physicians themselves, because we're doing a lot of things independently at night where we need to understand what we're looking at to give the best quality care to our patients. And then the other thing is, I've been in this field for 16 years and the opportunities for advancement still have not risen. One of the things that I've said for a lot of years is that I see we're bringing in more physician assistants and nurse practitioners, and no offense to those that are in those roles, but I feel like some of the sleep technologists that have been working in this profession and have learned these things about sleep would facilitate patient care on a different level because of that knowledge. And so having opportunities, I've said this field would benefit from having a role like a sleep practitioner that could be kind of that assistant to the physician to kind of help facilitate some of these patients that have been diagnosed and are on a course of therapy. So opportunities for advancement are another area where we're lacking as a profession. And then looking at what's been done so far to address the issues. So I go to a lot of these sleep conferences, there'll be job boards, and I see sign-on bonuses. And the highest sign-on bonus I've seen on any of the job boards was a $25,000 sign-on bonus. And it's not uncommon to see $10,000 sign-on bonuses. So we're seeing sign-on bonuses being thrown to those that are already working in the profession. And that will solve, it's kind of like putting a Band-Aid on the problem. Yes, we can get a technologist in there, but we're taking that technologist from another facility. And so that's one of the patches. Competitive pay, and you'll see with variances between private labs versus hospital-based labs and those competitive pay scales. That's also another thing that's been done to try to lure techs to come over from another entity. But again, not solving the problem because you still are taking somebody away and not filling a spot. Scholarships and grants for educational programs. The BRPT does a scholarship for those that are there's one A-Step Star scholarship per year. And we also do a $3,000 scholarship for those that are students in KHEP accredited programs. So the Jomo Nukunika scholarship is an annual scholarship to help try to get students in these educational programs. And then another thing that I was part of, with Dr. James Rowley during his presidency, he created a presidential task force to start looking at the sleep technologist shortage and get some feedback from the sleep centers of what's going on in their different localities, what things, for those that weren't having trouble finding techs, what was working for them, some suggestions of things that might help to get more techs into the profession. And so he gathered folks from the AAST, the BRPT, and COA PSG, along with some representatives from the AASM. And we met monthly to talk about what we were finding in these surveys and also come up with some possible solutions for what could be done to help facilitate this shortage. And so what we saw from that is education was a very big target of that. We need more education, we need more educational opportunities, we need more affordable educational opportunities within the field to try to get folks in this profession and to help deal with some of the shortage. So those recommendations got submitted to the AASM board for next steps. And I don't have anything currently at this time to give any kind of update on where that's at, but they are looking at those suggestions from the task force and making decisions accordingly. So why is education such an important part of this picture? When you look at education, education really provides legitimacy to a profession. When you look at sleep and you compare it to all the other allied health professions, I'm in an office suite with all the directors from the different allied health specialties, and looking at every single one of their specialties, they have an educational requirement to enter their field. They don't do on-the-job training. And so we're one of those few professions that still has that opportunity for on-the-job training. And so by having education, really it provides legitimacy that you know what you're supposed to know in that profession. And so that's why having proper training, making sure that technologists have a good awareness of all the facets of what working with a patient that has a sleep disorder, facilitating that diagnostic portion, and also the therapeutic intervention. All of that stuff has to work together. The other thing is when you have education, robust education expands the profession, because when you have a specific knowledge base, it allows you to interwork with different disciplines to be able to identify patients that are in those specific disciplines that may be sleep disorder patients. And so it allows you to expand the footprint of the profession to get more patients treated and to have a better set of outcomes. It doesn't matter what the discipline is. If you get sleep problems addressed, it does help to improve outcomes. And so it does expand our profession. And it facilitates more patient diagnosis and treatment, because if you're working in an interdisciplinary fashion, you're going to be able to see these patients that are identify with these doctors symptoms and signs that they need to watch for when they're working with those patient populations, to see, okay, this is a probable case for sleep disorder. They should really be evaluated and treated. So it does facilitate more patient care. So how can we use education to address the sleep tech shortage? That's the big question, is how we know how we got here. Now, where do we go? And how do we utilize tools that we have to be able to address this shortage? So the first thing we have to do is to increase awareness and interest. So we have to do a better job of marketing our profession. So one of the things that I know prospective students look at when they're trying to figure out, okay, do I want to come into this profession or not, is they look at social media. And so we really, as a profession, need to be cognizant of the message that we're putting forth in social media. And we know a lot of times that if something's not good, you're more likely to hear about it than if something's good. And so we have to kind of change our message, and we want to be able to reach our community better. There's also ways that we can talk to our program, our community of interest, through outreach. So one of the things is that every place has high schools and middle schools, and that's a open opportunity to go and teach these kids about what it's like to be a sleep tech, to get them excited about this profession. Because I know from talking to some of these high school students, getting them in, junior high, high school, where you plant that seed, they carry that with them. And so they're pursuing that avenue. Other things are health fairs. A lot of communities will do community health fairs. Having a table that you can share about what you do as a sleep tech, or sharing about how sleep is beneficial to other health issues, it raises awareness. And then community events, anything that you can do. Like I've seen a lot of times when I go and run 5Ks, I'll see all these different booths that are available highlighting different things. Well, we know that for good athletic performance, sleep is a critical part of that. So having a table at a 5K, a community event like that, or all these different, I just went to Oktoberfest a couple weeks ago, and I saw tables there for different health entities. So taking advantage of those community events to raise awareness. And we want to really make sure that we're highlighting why this is a cool field, and the importance of sleep health and public health. So one of the things I do is I do a lot of high school tours, and we have in our Health Sciences Center, we have all these different programs, and they have all these fancy high fidelity mannequins and simulators. And I'll have the teachers tell me numerous times that the students actually had the greatest experience in the sleep lab. because I share stories of how I've had patients come in and what they came in with and how we helped them get better sleep. And those stories fascinate these students. It creates an interest. And a lot of times, once you start sharing those stories, the students will start sharing stories with you of how they have a sleep issue or they know somebody with a sleep issue, and they'll share those stories, and it gets them engaged, like, oh, this is something I could see myself doing. And so if we take those opportunities to share the good and what we do in a positive aspect, it does drive interest. The other thing we need to do is expand education. So, as I mentioned, there's only 37 KHEP accredited programs in the entire country and only 31 RPSGT or CPSGT STAR programs in the entire country. So we need more programs. There's some states that don't have a program at all. And so there's opportunities to create new STAR and KHEP programs. And when we talk about the sleep tech shortage, it's not just a US phenomenon. We do have international communities that are also struggling to find sleep technologists. And the number one thing is education. How do we get these folks trained? We've got folks that are interested in becoming a sleep tech, but how do we get them trained and how do we get them in this profession? So creating new STAR and KHEP programs is one way. And if that's too much of an expense or too much of a time commitment, then one of the other things is that a lot of our programs need students. And so partnering with existing STAR and KHEP programs is another way that you can help with this shortage. Because I will share an example from our program. We've partnered with a couple of outside entities where we do all the self-study component of the training through our online platform. And then they do the skills in their sleep centers to facilitate the learning that's required for pathway 1 of the RPSGT. So if they don't have access to a program in their local entity, but they can partner with our program to get that education and then be able to train those techs from a didactic standpoint, and then they can train them in the skills component. So that is another way, is partnerships with these STAR and KHEP programs. The other thing is to provide financial incentives. So we see all these sign-on bonuses and still see labs that struggle to find folks even with those sign-on bonuses. So what about taking those sign-on bonuses, instead of paying them to one individual, say a $10,000 sign-on bonus? A $10,000 sign-on bonus could train 9 sleep technologists in a STAR program. And so you get 9 technologists that are trained, or if you only need 3 technologists, for example, you might be only spending half of that sign-on bonus in training, and then your institution's actually saving money. So taking those sign-on bonuses, make them financial aid, scholarships, grants, so that you can get these techs through training and get them ready to work in the sleep center. And you could also create creative ideas as far as how you get those techs to stay. You could have them do an initial contract where they say, oh, in exchange for you paying for my training, I will work for your facility for X amount of time. Otherwise, then, they would have to reimburse back for whatever that training cost was. But there's different ways that you can go and basically get yourself a workforce that will stay with you throughout time. It's not something that would be just a temporary fix. Then there's also those do your own, grow your own type of programs. So you can work with other specialties that are kind of looking to climb up the ladder. I've seen like programs that have worked with medical assisting, for example, patient care techs, where you can go and help those folks to grow into a profession that maybe they see as a long-term profession for them. So that's another way I've seen is those grow your own programs, where not only you do those work contracts, but also you can work with other specialties that are also integrated within the profession. The other thing is to enhance continuing education and advancement. So one of the things is that if you're going to ask more of your sleep techs, help them out. Provide some ongoing education opportunities for your current sleep techs, either to sponsor them to go to a local conference, to point them in the direction of webinars such as this that can get them some CEUs for free. Just providing those opportunities, letting your sleep techs know of what they can do to lessen their burden for the cost, because we all have to maintain 50 CEUs over that 5-year period to recertify. So if we provide those ongoing education opportunities, we make sure that our sleep techs stay in compliance with those requirements. And then also it's kind of an incentive for them. And then we want to also sponsor some exam fees for specialty testing like CCSH and the pediatric exam. So you can utilize, as you expand your footprint as a sleep center, there's a lot of different ways the CCSH role can be used to expand what you're currently doing. And so if you've got a sleep tech that is outstanding and you want to make them feel rewarded and feel like they are an important aspect of your team, then sponsoring them to take the CCSH exam and being able to utilize that in the practice. Or if you deal a lot with pediatrics, having that pediatric specialty. So those are another things. And then also tuition reimbursement. If you want to grow sleep technologists into management roles, or you want to help them learn more about the anatomy and physiology and the things that they're looking at, tuition reimbursement to allow them to take courses at a local community college or four-year institution where they can kind of learn more about what they're doing. So tuition reimbursement, or tuition reimbursement for them to go through the CCSH STAR programs, or for them to go through an A-STEP STAR program or a KHEP program. Offering those kind of things is another way that you can help to grow your team. And then step 5 is to expand public perception and recognition. So conducting public education campaigns on the importance of sleep and the role of sleep techs, because we're seeing this growing awareness of sleep and this growing perception of, hey, I need to get my sleep checked out. I need to know what's going on. I need to know how to fix these problems. That is something where we have an opportunity to educate the community. And so when we show how sleep factors into everyday cognition, lifestyle, health, and then show what we do as sleep techs to help improve sleep so that folks can function to their greatest capacity, that is also something that we need to look at. And then also creating recognition programs for outstanding sleep techs and education programs. If we want to highlight those that are doing it well, then we need to have some sort of recognition programs, because if we don't recognize those are doing well, that's where some of that burnout creeps in. If you do a job to your fullest capacity and nobody recognizes it, that's where you get discouraged. And so having recognition for those that are doing things well, and also those education programs that are maintaining high standards, producing quality technologists in the field, those folks need recognition. I see a lot of our other allied health specialties where they recognize programs that have high pass rates or are high job placement, and their national organizations recognize them in that capacity. We need to do a better job of recognizing those that are doing things well. And then better training materials. One of the greatest challenges I have is that I look at my other allied health directors, and they've got all these cool simulation tools that will simulate what they need to do within the profession. I have yet to find a high fidelity mannequin that simulates sleep and sleep disorders to be able to train students. There's not a good simulation tool out on the market for simulating how to do PAP titrations. That's one of the biggest challenges I see students facing, is trying to know how to do titrations, because there's just not good tools that will simulate a scenario that they may encounter in the workplace to train them on how to make critical decisions. So I'm going to put a challenge out to the vendors out there to partner with education programs to develop some simulation training, things that are more than, about the only simulation training I really have for my students is ISR. That's the only simulated training I've seen on the market that can give them some perspective, but it's not a full night study. So they're not having to make critical decisions of when to split a patient. They're not doing titrations on there and judging data to know when to split a patient and when to increase pressures. That stuff just doesn't exist, and we really, really need it to be able to have our techs be effectively trained so that they can deal with situations on their own. And then we also need more textbooks. We have a very limited amount of textbooks, and most of our textbooks are not getting updated very often. So there's really only 2 textbooks that I'm aware of that are technologist focused that have been updated or are in the process of being updated. And so that's another challenge, is that we have a lot of outdated materials and we have a lot of rules that have changed over time that we don't have education that can train on those changes. So we need better textbooks. I know from an educator standpoint, I have to piece together a lot of journal articles and a lot of materials that, because I can't find a textbook that covers the content of my course. So we do have that challenge as well. So what happens if we don't get this problem fixed? We have a great challenge on our hands, and that challenge is going to remain unless we figure out a way to fix the problem. So the inherent challenge that the shortage continues is we have an increased burden on our sleep techs. And with that increased workload, there's the higher risk of tech burnout. We see that techs are getting tired of not having support. And so we need to bring the next generation into the profession. If we have techs that are burned out, it affects focus. We know that we teach our patients all the time about the effects of sleep deprivation and being overworked. And if we ourselves are in the same boat as our patients, that's going to affect the way we think through things. That's going to affect the way we take care of our patients. So there's that risk for a decline in patient care quality, not being able to focus and be able, when you're trying to juggle multiple things throughout the night, being able to give each patient that individual focus. As I've mentioned several times now, longer wait times for sleep studies. You have to have technologists to facilitate in-lab studies. And so if you don't have technologists to do that, then those patients are going to have to wait longer in order to get their sleep studies completed. And if we have these patients that have sleep apnea, for example, that's just going to worsen their health over time. And so as their health worsens, that presents more health issues. That's going to create a rise in their healthcare cost. They're going to have to visit their doctor more often. They're going to have medications that they'll have to be on for blood pressure, because we know that if a patient's effectively treated, it can affect their blood pressure. So we know that we can bring down some of those costs if we get them on a course of therapy. But if they can't get in to get evaluated and on therapy, we're not going to be able to bring those costs down. It also creates pressure on the training programs. So we're always, as a training program, under this pressure to make sure that we have a certain student enrollment. And if we don't have that, then there's a pressure of, okay, is the school going to still let us continue if we can't get enrollment up? So we have that pressure that falls on us to get more students. And then the regulatory and accreditation challenges. Unfortunately, there's only so much you can do when legislature says you have to have certain requirements. So we need to do a better job of getting involved and knowing when regulatory changes are happening. And then accreditation challenges, also making sure that sleep technologists are maintaining continuing education. If they're working consistently, when are they going to have time? So we have all these challenges that are faced in this aspect. Also, the impact on research and development. A lot of times sleep technologists are part of that research project. So if you don't have sleep technologists that can move into that arena, it could affect the research that is being done to develop new solutions for some of the issues that we do see in sleep now. And then the overall public health impact. We know that if patients are not seen, not treated, it affects their overall health. So it creates this greater dependence on healthcare, greater healthcare utilization. And so we want to see those patients coming into the lab, getting evaluated, and getting on a course of treatment. So as we wrap up, so I can give some time for questions and answers, we've got this big problem. And this is not the first time we've had this problem in this profession, but if we want to grow our workforce, we need to train a workforce. We can't just bring somebody in and expect them to know all the ins and outs of sleep. And especially since we have a patient population coming into the lab that is sicker than ever before, we need to make sure that those technologists coming into the workforce really have a good working knowledge of sleep, anatomy and physiology, medication impact, all of those parameters that we're evaluating. We have to make sure that workforce has that knowledge base. We know that the existing workforce is declining, and so we have to get the next generation in, because we're going to see more people continue to retire. And if we don't start planning ahead and start trying to get the next generation interested in this field, we're going to have an even worse problem than we have today. And so if we can train that next generation of sleep techs, we can help be part of that solution. We can start having the workforce grow. We can get that exuberance. I do know that there's things that are marketing initiatives that the national organizations are trying to initiate to drive awareness of the profession. So we got to get the next generation in here excited and helping to facilitate patient care, because at the end of the day, it's about the patients. And we want to make sure that we can have the greatest impact on overall health as possible. So,
Amber, that's outstanding. Thank you. We have quite a few questions to get through. If we can't get through all of them, we can respond to y'all personally after the fact. Starting out, Robin had asked, are salary concerns also a contributing factor?
yes, so salary concerns, especially I'm seeing this on the private lab side of private labs trying to compete with hospital-based labs. I've talked to several managers from private labs, and that's one of the number one things they come to me with is, I just can't compete salary wise with these hospital labs and what they're offering. And so that is a part of the challenge, because we kind of have almost like a bidding war that's going on in our profession. We're seeing all this competition, but it's trying to go at a population we have and not grow a population that we need. Um,
James had commented, more just if you could comment on this, that many physicians don't understand the field of sleep. And I would add that with your work on some of the committees at the AASM, and also you're probably privy to some of the challenges that we are finding that not having enough sleep physicians boarded in sleep, or physicians boarded in sleep. Can you just comment on that a little bit for us?
Yeah, so one of the challenges is that most physicians, when they're going through medical school, only get about 2 hours of sleep education, if that. And so they don't know what to look for. And that's why I've been advocating a lot for expansion of that CCSH role, because there's a lot of opportunities that I think our sleep centers are missing by not incorporating that role into practice to do outreach to these physicians. Because if you're utilizing this person to educate other specialties on things to look for in their patient populations and to get those patients into a sleep center, then you're helping to grow your practice. And sometimes that initial investment you don't see right away, but over time, as your volume increases, it pays back what you've invested. And so we need to see greater utilization of our sleep technologists, especially those that are very well advanced, that have knowledge bases that we're not tapping into. We really need to utilize those folks to a greater degree to expand patient care.
That's helpful. Now, Manu had reached out asking if there are any training programs for sleep techs offshore can enroll. I know you've done a significant amount of work out in China right now. I'm glad we caught you before you jet off over to Rome. So can you share some resources that our international folks might have access to?
Yes, so I can tell you that at Collin College, we have BRPT STAR programs for both RPSGT and CCSH that are able to be utilized internationally. So we do have a partnership in Shanghai, China, with a hospital system there where we are doing the didactic training for their sleep technologists. They'll do our online platform, and then they're doing their skills training there in China. So we do have capabilities. I'm sure there's probably other self-study programs out there that have the same capabilities with the online platforms. So with self-study, with Pathway 1, you can do the self-study program and then do the 960 hours of clinical and pair those together to be able to train. So we're seeing folks that are in the international scope that are doing those kind of training programs and then doing their own clinical hours in-house.
That is helpful. You'd mentioned previously in your lecture that there are two books that you primarily like to use. What are those?
So Fundamentals of Sleep Technology by Rita Brooks and Cynthia Matthijs and Lee Chiang. That's a book that does get regularly updated. And then the other one is that has been updated recently was Spriggs Essentials of Polysomnography. Those are the only two books that I've found that are technologist driven that have been updated in recent years. Some of the textbooks, the older textbooks have not been updated and have outdated information.
Okay. This one's a little bit more pointed, I think, with the work that also you do with the BRPT as the president. So, what is the industry or the BRPT doing to promote expansion of duties recognition and reimbursement of the CCSH credential, more along the lines of a physician extender, provider extender?
So I personally have been doing a lot of talks on CCSH and how it can be utilized, and I've done talks that were driven specifically at physicians. I did get to do a talk at one of the postgraduate courses at Sleep this year, sharing about how that role can be utilized. We're trying to do better advocacy and promoting that in literature and also in speaking opportunities to try to drive awareness of that. And then also we have the reimbursement guide on the website that identifies and it is something that we do need to update because there's always new billing codes coming out. But that is some of the things that we're trying to do. We're also working in conjunction with our sister organizations like the AAS and the AAST to do collaborative initiatives. So there's a number of things we have on the horizon.
That's a very heavy question to ask towards the end of a presentation today. So I'm glad we didn't do this on a Friday.
Yeah.
So another one, and I'd say this is pointed, and I mean that in a loving way, because going from days to nights can be very challenging, especially being in sleep and knowing what good sleep hygiene is and maybe not practicing it, right? So Kelly had asked, how are you convincing potential new sleep techs that working overnight is a good idea?
So when we're working with students, we try to explain to them the importance of sleep hygiene and adapting your schedule. If you're going to be a night tech, you kind of have to operate on a night schedule. And bouncing back and forth is one of the hardest challenges. And we do see a lot of technologists that want to have the night schedule when they work and then bounce back to days on their days off. And it does create this imbalance for the clock because your internal clock really doesn't know what time to be awake. So when we're doing our training for our students, we don't do any early morning classes. Our classes are more of an afternoon evening schedule to try to get our students moving to that circadian cycle, which is more conducive to what they're going to be doing in the profession. We do our clinicals overnight to get them used to the night shift. So if you're adjusting and educating to adjust to that cycle, that's the thing. But if you're going to try to flip flop back and forth, it's always going to be a challenge no matter what.
That is very true. So Robin had also posed another question. So she thinks that we need to advocate for reimbursement, as many of us do, for CCSH from our payers, similar to the diabetic educator role. She believes and knows that the AST has worked on creating a standardized curriculum for patients to facilitate this. How can we, as an industry, work with regulators and legislators to make this happen? Because unless our voices are heard, it's really hard to get that momentum behind our story here.
Yes. Well, one of the biggest things is we have to advocate with our physicians because they're the ones that are facilitating the practice and they have to jump on board. So we have to do better advocacy as technologists to the physicians themselves to make them understand how that this may take an initial investment that they might not see back right away, but over time with the increase in volume is going to pay dividends in the back end. And that's one of the hardest challenges when I talk to physicians is, well, how am I going to make money if I have somebody in CCSH? Well, we need the physicians to advocate because they're the loudest voice when it comes to our payers. We need them to advocate better for us. We need to advocate for ourselves. So as CCSHs, we have to say, hey, I bring this value. Here's how you can utilize me. And we have to make them aware. So it takes a lot of voices working together. I think some of the challenges is we see a few voices that are advocating, but not a mass voice. And so if we have more voices advocating for things, then we're more likely to see change, because then it's not just one person preaching to the choir, it's multiple people preaching to the choir. So trying to get that change enacted, it takes more voices. And we know that anything that we do in this profession, if we don't have a collective force working on it, it doesn't get done.
That's very true. So, aside from the legislative aspect, just growing our community and community awareness, how would an RPSGT go about spreading the word in their area? What's a good place to start for them?
So a good place to start is reaching out to high school guidance counselors or some of the like college prep type of courses. I go and speak a lot at middle schools and high schools to students that are in those prep courses, or they're in a health sciences academy. And I talk to them about their sleep hygiene and sleep deprivation and the effects on them as they're developing. And it really opens up these kids' eyes. But not only does it open up the students' eyes, but it also opens up the educators' eyes. And then I've had educators that are like, we heard this awesome talk, and they talk about it to other community events, and then it kind of spreads from there. So you have to kind of start somewhere. And then as you become more well-known in your community, then you get more opportunities. I've spoken at nursing homes, I've spoken at local libraries. I have done tables at different events. So if you get yourself out there, like 5Ks are one area I see always health, health information tables or community health fairs. Those are the two main places I think that you can really take an opportunity to just talk to people. And if you have cool swag, they come to visit you no matter what, or candy.
That'll get me every time. Yeah.
Uh-huh.
What I would add to that, I mean, it's a great opportunity, and sleep impacts, as we all know, every system in the body. So there's always a way to tie it into pretty much any health fair conference that you want to go to, whether it's, hygiene or sleep or fitness or overall health. There's always a way to kind of sneak sleep into the conversation.
Or even reaching out to some of the corporate offices or sports teams. There's a lot of things that if you talk about performance, and especially I love to use kind of the story of Google and how they've really embraced sleep, and they encourage their folks in the afternoon to take a nap in the nap pods, but they tell them to drink a cup of coffee right before they do it. So when they wake up, the caffeine's kicked in, they get better productivity. And so if you share in the corporate space too about sleep, and also in the sports space, that there's tie-ins, everybody can relate to sleep, everybody has to sleep. So unless you get somebody that says, I don't sleep, but they don't think they need sleep, but there's always those few cases. But usually most people, if you talk about sleep, they're like, oh, here, let me share my story, or this is what's happening around me. So it's, if you start the conversation, it opens doors too.
Yeah, we don't want to talk about that fatal familial insomnia. That's
No.
no, nobody wants that. So, one last question. We've got about 3 minutes before we wrap up here. Angela had reached out asking, um, this has been a great presentation, and you've highlighted a lot of needs and also solutions on how to implement those. What are some examples of CCSH holders that maybe the BRPT may be interested in highlighting some of these success stories? I think years ago there was it Andrea was on the cover of, oh shoot, which magazine
Sleep
was
review.
that?
I want to say sleep
Yeah,
review.
yeah, yeah, yeah,
Yes.
for her navigator role. Any
Yeah.
other examples that come to mind, or would the BRPT be interested in highlighting those success stories?
Yeah, I know when I did a talk at Sleep, I brought on a couple of co-speakers with me on, we did a talk on CCSH and utilization of it. And I brought in Brendan Duffy, who does a lot with sleep coaching for athletes. And then I brought in Kelly from Wellstar. She also talked about how they're using the sleep navigator role very successfully within their institution. So those are a couple examples that are using it very well. I know Northwest has used it where Andrea was at, and so Northwestern, and so there's been different programs that have done it very well, and those are ones that I've tried to, and when I have speaking opportunities, bring them alongside.
That's helpful. Thank
Yeah.
you. Well, we're just about out of time here, everyone. So I want to thank Amber for presenting today. This was very engaging, wonderful feedback and questions from the audience here. this sleep tech shortage, I mean, it impacts so many of us. It's very relevant. And so it's was helpful to understand where we were coming from, how we got to this situation, but also the fact that you offered many different solutions on how we can move forward from here. So thank you for everyone for attending this session. We appreciate you sharing your time with us. Amber, thank you so much. This was just wonderful. So as a reminder in closing, everyone, please look for an email from Cadwell Education for that brief survey to fill out for your CTSE credits. Thanks, everyone, and have a wonderful day.